So I heard a really cool story one time from a college class. This class was talking about all the different drugs and their purpose for medical purposes, so like high blood pressure, migraines, things of that nature, depression. And this professor had a 2.5 hour class talking about all these different drugs and what they did and how they could help the human body and help a person out. And so he was going through, if you have high blood pressure, okay, you're going to take this. If you have migraines, that's what this drug helps with. If you deal with depression, that's what this drug helps with. And this went on for 2.5 hours of a class. And then it got time for the class to end. The students were packing up, and he goes, "Oh, I'm so sorry, I forgot one drug that solves everything we talked about today. It'll help fix everything we've talked about for the past 2.5 hours." And as you can imagine, the students were sitting on the edge of their seats, so excited to get this information. They're going to find this golden nugget of information that probably none of their peers knew. It would give them an advantage in their fields and help them correct their own health issues that might be going on. And the professor sat there, a little grin on his face, and he goes, "It's effing exercise." And the students sat there and they were shocked and thought, wow, I just paid all this money for this class to learn that movement fixes things. And so one thing I want to take from that is, as funny as that story is and as true as that story is, we often grab for this quick fix. We look for something that is low investment in terms of what we have to do for a high result. And that's fine, I understand that from an efficiency standpoint, but you have this beautiful tool of movement that is super powerful if you actually utilize it. If you have pain, movement can often solve that pain issue. If your health is deteriorating, movement can solve that issue. If you're not living to the fullest or you feel like you're not maximizing your days, movement can help fix that issue. And it's something that you have at your ability regardless of what ability level you do have. You might have to have a modification for certain movements. You might have to do a different variation, but there's plenty of opportunities out there. I've been working with a lady recently. She broke her hand or broke her wrist on the tennis court, and she was, demoralized, active person, and she was like, "I don't want to stop moving. Like, what do I do?" I said, "Keep showing up to your training sessions." And she was, a little bit shocked, and she was like, "Well, what are we going to do? I can't hold on to a weight with this hand." I was like, "Just keep showing up to your training sessions." There's plenty of things you can do, modifying things, attachment points with a band, to get around just that limitation. There's other limitations you can work around and still have valuable movement that can have the same impact as medicine. And guess what? Movement's free. So today I challenge you, if you're watching this, you have a desk job or you're sitting down throughout the course of your day, I challenge you to take some micro breaks. So get up every 20 minutes, just kind of move around a little bit. It doesn't have to be for a whole half hour or anything. Just take a little 2-minute break, get the arms moving, wrists moving, ankles, you name it, sit back down and get back to work. If you have to drive today, think about your hips. Are you rotating to reach that pedal? Make sure your hips are as even as possible. Find that seat position, and then think about your shoulders. Don't let them start creeping forward on you. If you're watching this from your phone, bring it up here. None of this down here. Get the head up, nice and controlled. You can control these little pieces of movement that are going to help benefit your entire life. So at the end of the day, when it comes down to going for the next pill, I challenge you to remember movement. It's free, and it absolutely works.